And every Tuesday at this time, we check in with another medical professional, brought to you by Independence Health System Expert Care here. And today, we welcome Dr. Lisa Hildenbrand, who is a gynecologist, obstetrics physician at Independence Health System. Doctor, good morning.
Good morning, Larry. Thanks for the opportunity.
Did you ever think you'd be seen on the radio? With our live stream, you can see the good doctor, brought to you by Metropolitan Window Company. So thank you for being with us. This is Women's Health Month, and so important information for women. One of the things I know, October, breast cancer awareness and all of those things, but otherwise, talk about the work that you do, particularly at Westmoreland Hospital.
Sure. Well, one of the things that I am intimately involved with is working with women who are nearing the menopause and who are in menopause. Um, Menopause is when a woman, it's a natural process, and she will stop her menstrual cycles after 12 months of no menstrual cycles. That's the definition of menopause. And at that time, she can no longer become pregnant.
And I think a lot of people, guys, in particular, might not be aware of the sensitivities of that completely, which is important. So physiologically, how does menopause affect women in general? I know it varies case by case, but in general, what does menopause present as for individuals?
Absolutely. So you're right. It is a very large time of transition for women. And during that time, in the initial stages, somewhere in their early to mid 40s, on average, women will start to notice changes in their menstrual periods. They can space out, they can become very irregular. Women can also start to notice hot flashes where they feel like, their face is just burning up and they are, sweating and just very, very like palpitations, night sweats. Many times there will be significant changes in sexual interest, as well as vaginal dryness. Pain with intimacy can occur. Women can notice significant moodiness. They can have other problems, insomnia, weight gain. Those are some of the very common changes that we experience.
And as a physician, what do you do to help remedy some of these symptoms?
Yeah, I'm so glad you asked that. First off, I would like to say it's very important for a woman to make sure that she is getting her annual checkups, mammograms, pap smears, and physical exams, because sometimes some of these changes can be abnormal, and we want to be sure that the changes are normally what should be occurring, and that she's not having a different type of a problem. But for me, whenever I see a woman who is in this time, the most important thing for me is to check and see what are her symptoms, because all women will present differently. And it's important that I tailor her care to what's her medical history, what's her family history, and what are her actual symptoms.
So those annual checkups really help you as a physician set a baseline for that individual, correct?
That's absolutely right. And then from there, I can take the medical care. We have many wonderful options to treat the hormonal, or excuse me, to treat the menopausal symptoms. There are over the counter options. There are antidepressants that actually can really help hot flashes. There are non hormonal ways to help the hot flashes, as well as hormone therapy.
And generally, what ages do women experience this, understanding that it does vary, but generally, when would that process begin for most women?
Sure. So the average age to be in menopause is 51 in the US. But usually early 40s, mid 40s is when they'll start to notice the transitions.
That's earlier than I thought.
Yes.
Well, great information, women's health awareness in this month of October, and we thank Dr. Lisa Hildebrand with Independence Health System Appreciate the time, Doc. Thanks. Keep up the great work.
Thank you so much. Take care.
You got it. Brought to you by Independence Health System Expert Care. Here